So good evening, everyone in Delhi, and good morning and good afternoon to those who've dialed in online. This is a hybrid session, and on behalf of Vital Strategies and WHO CRO, I wanted to give you a warm welcome and welcome you to this session here. And it is indeed a proud moment for India and for all of us here with the India AI Impact Summit being held in New Delhi. I think it's quite timely and appropriate to sort of have this kind of a convening in India where global leaders, thinkers, practitioners have all gathered to really reimagine how can we lead or accelerate social development. And I quite liked the way it's been put together, basically saying Sarve Jana Hitaya, Sarve Jana Sukhaya. Effectively in English it means welfare for all and happiness for all. I think it resonates very well with what Vital stands for. Like many of you, we work towards a world where, there are health systems which are equitable, which are effective, which are resilient. And I think Vital's work across, as you'll see today and you'll hear more, across 80 countries, we've been working very closely with our partners, collaborators, helping governments to really strengthen the health systems. And for this, I would say data has been a key component of our work. Effectively, how do you use data to make decisions? How do you really sort of strengthen your systems? And we believe that that leads to saving lives. If you have good data, you have good sort of policies around it, you can save a lot of lives. And that's really, I would say, the core of the kind of work Vital does. I also believe that data is just not information, it is power. It is power to prevent disease. It is power to build, equitable development. It is power to lead to policies which can actually effectively save lives, as I said. So that data intelligence into real world impact, that's really where I think we are all interested, and Vital, as I said earlier, does a lot of work. So it's really where innovation can meet impact, and the context is really how can you really save lives. So in this journey of our work in data, and I'm very glad to see Adam here, who's flown down all the way from New York. I think, as you hear more, he'll moderate the session. A lot of our work on data is driven by, building those foundational systems. And when I look at, the sort of journey we're going through, and especially I would like to, highlight that, data plus AI, it's an intelligent way of looking at information, that how can you really in real time analyze data and come to decision making where effectively you could, as I said, save lives and, lead to more prevention. So when we were sort of invited for the National AI Health Strategy, I would firstly like to, and I think we should all applaud, and a big applaud to the Government of India for releasing the first strategy on AI health. I think it's probably the first one global, so a big applaud to the government. I think we have champions here who I would personally like to highlight. Dr. Karthik Arappa right behind standing and his team. I think they did a fantastic job. We were invited to one of the consultations. They had 4 of them. And I would say it was a phenomenal amount of effort, work, very well organized, structured, and very insightful. So thank you very much for having us for that sort of thing. I like to add that aligned to that kind of work, even at Vital, we've been sort of rethinking, reimagining the world, with all the data intelligence. What is really required to make systems effective? How do we really sort of imagine a world where more lives can be saved, more data can drive, whether it's early warning signs, surveillance, and prevent lives. So our recent report, it's called Foundations and Futures. I think you can download a copy if you don't have it. There's some of them out here printed. This journey started with our offices globally. As you probably know, we worked across 80 countries with offices in 6. So our Brazil office done some very good work on it, and that's where we started. We started looking at systems and where is the readiness of different countries. And this report on Foundations and Future, highlights some of that, and it really highlights the need to see how can governance frameworks be built, how can you really have interoperable systems. Those are the foundational things. And with that foundation, how can you imagine the future? So today our goal is, and I think it's a goal for the long term, it's not really AI, But how can AI really improve health outcomes? How can we really use this as a tool to save lives, to prevent people falling unwell, and those sort of things? And so in this slide this evening, I think we've got a very esteemed panel, key speakers out here. You will hear how do we really sort of take this insight into action? How do we, move from pilotizing to, scaling these things for real world? A lot of examples at the end of the foundation report and many more around, I'm sure. So I would encourage you to sort of, look at them and also give your feedback on them as well. And, we're very proud to welcome all our panelists here. You will be introduced to them. Dr. Ilona, thank you for being here to give the keynote. We have voices from across, and my colleague, Dr. Adam Kapati, will be moderating it. So, without much ado, let's begin. And again, I warmly welcome you all here to New Delhi and to this convening we've organized, and I hope it'll be a fruitful one. We do want to keep it interactive, and so therefore I would recommend that there's a mentee meter or mentee, sort of a, whatever you call it. I still have to learn these terms, right? So it's some mentee meter, and you can download it, and I think there would be an interactive, because we did feel that apart from the people on the panel, there is so much expertise both in the room and online, and it'll be good to get your insights and feedback. So let me start with actually welcoming in sort of online Dr. Mary Ann Etiebet. I know some of you probably have met her, but she's she's got that gravitas and personality to take this kind of agenda forward. So Dr. Mary Ann Etiebet is the President and CEO of Vital Strategies. She's a leading global expert on public health, and she formerly was with Merck for Mothers, serves on the board of Save the Children Center for Development. Dr. Etiebet is a physician and an MBA graduate from the Yale University, and so she brings a powerful combination of both clinical expertise, strategic leadership, and a global health vision to our work. So please join me online to welcome Dr. Mary Ann Etiebet and her message. So over to the online.
Good evening, everyone. On behalf of Vital Strategies and the World Health Organization's Regional Office for Southeast Asia, it is my honor to welcome you to Actionable AI, Building Health Systems for Public Health Impact. Thank you so much to the WHO CIRO Regional Office, the Government of India, for bringing us here today for this event. I'm joining you virtually from Nigeria, where I had a prior commitment. But tonight, you'll be hearing from an incredible group of leaders across the global public health space, including our keynote speaker, Dr. Ilona Kickbusch, Director of the Digital Transformations for Health Lab and member of the Lancet and Financial Times Commission governing Health Futures 2030, Growing Up in a Digital World. You'll also hear from representatives from WHO CIRO, the Government of India, Africa CDC, and the Lancet during our panel presentation, which will be moderated by Dr. Adam Kapati of Vital Strategies. They will all examine the health system foundations required to enable the effective and equitable use of actionable AI in public health. And that's the key word I am so glad made it into the title of this event, Actionable AI. For the billions of people living in the global South, AI has the opportunity to reshape public health systems and improve health outcomes for all. New applications that link data across sectors and sources are demonstrating how AI is driving faster detection, smarter planning, and new ways of engaging with the public. This past December, Vital Strategies launched the first version of a consultative report entitled Foundations and Futures: Reimagining Public Health in the Artificial Intelligence Era. The report includes interviews with experts and thought leaders, providing a landscape scan of AI use cases and country readiness assessment. It reveals a consistent pattern where core public health data and digital connectivity foundations are weak, actioning AI remains stuck in pilotitis. But where these foundations are strong, AI can be integrated responsibly and impactfully to improve public health for all. Tonight, We are so excited to share an updated version of the report, incorporating country-specific insights from engagement with senior government, implementation, and technical leaders right here in India. And I'm honored to share that when it comes to foundational AI readiness, India, unsurprisingly, scored remarkably high. A big congratulations to the Government of India on this week's exciting launch of their National AI Strategy for Health, which will enable even greater scale, equity, and innovation in the AI and public health space. However, my big takeaway in all of this is that AI is moving faster than the systems meant to support it. And so what do we all need to mobilize around now? Really mobilize yesterday in order to action AI for positive public health impact. What are the strategies, structures, and systems we need to operationalize in order to capture the promise of AI? Well, you'll have to read the Foundations and Futures report to find out. But during this summit, I do believe that it will be important to ground all of the conversations about the promise of AI in the practical realities and diversity of public health systems across the Global South. I look forward to the many ideas, actions, and collaborations that will be catalyzed in this session. Together, we will build the next generation of public health systems designed to tackle today's threats as well as capture tomorrow's opportunities. Once again, I thank our co-host, WHO Cero, our speakers, panelists, and all of you in the audience for joining us today for this important conversation.
And so, without much ado, I'd like to welcome Dr. Adam Karpati, who's here from New York. He heads all our global programs, and I think Dr. Karpati brings a global perspective and a cross-country experience to this conversation. So over to you, Nidhi, and why don't you sort of take it from here? Thank you.
Thank you, Ellen. And I'll quickly introduce myself. I'm Dr. Nidhi Chaudhary. I work with Vital Strategies as Principal Technical Advisor for the Data for Health initiative. I'd just like to welcome all of you. And before we go further, let's start with a quick audience reflection. I'm going to be popping in, in between the entire session just to keep all of you busy. So can I just ask all of you to either scan the code that is there, Menti code, or you could log on to menti.com and enter the code that is reflected there, which is 49659980. The Menti scan is on your tables. I'll also request whoever is online, can you also please log on to menti.com? We would like everybody in the room and online to be connected. So as we start, we'd like to ground today's conversations in shared aspirations. So our first question here is, in one word, what outcome do you most hope AI can help achieve for public health systems and population level impact? What is that one thing that excites you that AI could do, especially for health? Yes, we are getting quite a few responses here. So equity there, accessibility, access, scale, evidence. I see scalability. Great, please keep going. We have 92 people logged in. We have 70 responses here. And I'm sure it's exciting to see what's there on the screen. So these actually capture exactly why we are here today. And, with AI, we feel that it strengthens health systems and it improves lives equitably. And that is what it's supposed to do, and not just stand alone as one intervention or as a pilot. So let's ground our conversations in what we see here on the word cloud. Thank you, everyone. Those who haven't responded, please continue to do so as we move forward. With this shared vision in mind, it's my pleasure now to invite our keynote speaker today, Professor Dr. Ilona Kickbusch, to help frame the opportunity and urgency for actionable AI in public health. Dr. Ilona Kickbusch is the founder of the Global Health Center at the Graduate Institute in Geneva. She's presently the director of the Digital Transformations for Health Lab at the University of Geneva. Her areas of expertise include political and digital determinants of health, health in all policies, and global health. Dr. Ilona was co-chair of the Lancet and Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World. Thank you for joining us, Dr. Ilona. I'd request you to come up.
Well, distinguished colleagues, ladies and gentlemen, it is an enormous honor to have been asked to speak to you. And actually, after having attended a couple of days at the summit, I feel even more honored than I was when I was initially invited, thinking of all the extraordinary people that are here at this summit, and you have asked me to come and speak. At the same time, I feel after this attending the last few days at the summit, I sort of feel like, as one says in England, bringing coals to Newcastle. Because who am I, who are we also, to some extent, in the global north, to speak to you about this subject, because you are doing it. You are doing it to such an extraordinary extent. And I will come back to that as I make my points. And you have seen the word cloud here, and those are words that have fallen again and again during this conference, and you will also hear those from me. I think the key thing that one is realizing, and it's really becoming clear in this global summit, but it's not yet clear everywhere in the world, and sometimes I feel it's less clear in the global north than in the global south, that artificial intelligence is no longer peripheral to health, to global health, to public health. And that it's part of its core infrastructure. And I think this is one of the shifts that we are discussing, that you already alluded to. We are not talking about a technology, we are talking about an infrastructure. And this infrastructure needs a certain type of development, it needs certain guardrails, it needs certain investments. And, as some people have also used this word ecosystem, which is perhaps more dynamic than infrastructure, but that is really what we are looking at. So we know that artificial intelligence, as we speak, is transforming health systems and will transform it even more. So whoever organizes the next summit will be faced with the next big shift of change that is occurring. The real question, though, is, and this is why I believe this panel and discussion here is so important, will what happens strengthen public health? Will it increase equity? And one word that I don't think I saw on that word cloud, will it increase trust? Those three issues, I think, are absolutely essential. Will it increase those? Will it strengthen those? Or will it weaken those? And of course, we do have experiences that because of the attraction of artificial intelligence and what it can do, that equity is not always that much in the center, that public health and prevention lose out towards fancy suggestions of what one should be doing in the health system, And we know that trust has declined. And I found it very exciting and interesting in one of the public health sections today that the speakers really highlighted that this will not work if the community, if the individual person, if the individual patient doesn't trust the system. And that is also by association, because if AI becomes ever more strong, visible, etc. in the system, and people don't trust it, what does that mean for their trust in health professionals and health systems? So this trust by association, I think, is also something that goes both ways. If you trust your professional, and it can help trust AI, but I think the other thing is something we need to take into account. Another point that I think we don't really build on enough is that public health has always changed and evolved with technology. We'll say, oh, these new things, digital AI and whatever. I mean, we forget what a new technology water and sanitation was. Imagine building all the water and sanitation systems under the City of London. It was just extraordinary. And it was built mainly by private money. It wasn't that different, from today where those tech bros are, making the money and moving the system forward. Things are not that different. And to some extent, we can learn from that history how it was then that a government took action, that rules and guardrails were put in place. And there's wonderful stories around that. And, we know about the oil and the robber and other barons in this gilded age, but that there were actually water and sanitation barons. Many of them came from the United States. And what was the most attractive thing at the time was if their daughters were able to marry a British lord. So, there's all kinds of social factors that also play a role here. So we've had water and sanitation, we've had laboratories and vaccines in the 20th century. We've had, recently computing and genomics. And so actually every major advance in public health has been linked to innovation and technologies. And I think this is something that we can pick up, where we can learn from the past, but where we also always know that not every one of these innovations in the long run contributed to more equity. And this is the challenge that's been put forward by the World Health Organization to say, whatever technology we introduce, we have to keep in mind equity, we have to keep in mind human rights, and we have to keep in mind the social determinants of health. What is the social context in which we develop those technologies and their transformation? So AI, of course, is already changing surveillance, it's changing decision support, it's changing system management, it's in particular changing communication and information integrity, and that takes us back to the trust issue. And if we combine these four changes, we see that one risk stands out amongst these four domains. And it's already been mentioned that AI is advancing faster than public institutions can govern it. And this is one of the biggest challenges we have, not just scale also, as was mentioned, but speed. And that's the difference to the earlier public health changes through technology that I've mentioned. This notion of speed, the very, very rapid development. And we're not really ready to deal with this speed, and to some extent we need artificial intelligence to be able to deal with this speed. So there is a kind of contradiction here that we need to address. And since it is advancing faster than public institutions can govern it, and WHO is one example. WHO is trying, to find global governance mechanisms. It's establishing ethical principles. It's doing a lot of important work, but this thing is rushing forward, and our decision-making, policy-making processes are very slow in comparison. So what we are experiencing with everything that we feel, this is really great. Every time I sit in one of these panels, I say, my God, this is really great. But then you sort of say, what about the dependence on private platforms? What does that mean? What about the limited transparency? What does it mean if, these data sets, on the one hand, are generated in the public sphere and, should be shared, but those data that are generated in the private sphere are not shared? I can give you the example. We are working on a Lancet series on the digital determinants of health, what it means for children and young people. And we have done all kinds of searches and overviews and systematic reviews and this, that, and the other on what is the impact on the health of children and young people. Now, we're doing all this while knowing at the same time that the very companies that are developing the algorithms that lead to some of these effects on children and young people are sitting on masses of data that could actually help us resolve this problem, but they are not being shared. So we still, in this AI situation, have a question of data for the public good and how they are shared, and what the issue is of weak accountability. I do think there is not enough accountability in the AI system yet, and that, of course, is due to fragmented oversight. So this is very important, and this is also why it is so important that the development right now and what is being discussed here in India is being discussed in the world's largest democracy. This is absolutely essential because we know that we cannot have technological capacity replace democratic capacity. And this interface, I think, is also a fantastic opportunity and responsibility of the Indian subcontinent. And that's why India's role is so important. And I want to make one proposition to you that maybe some of you want to take forward. I'm a political scientist. I look at governance. And usually when people speak about the governance of artificial intelligence, they say, well, we have three systems. We have a regulatory system, which is us in the European Union, which seems to sort of shut off all the innovation, some people say. But it starts out from guardrails, it starts out from safety and those kind of things. We have, of course, the US system, which is highly privatized, and then responds not through regulation but through litigation. And we have a system that we don't quite know enough about, which is, the state-led system in China. But what I see growing here is a fourth system. And this fourth system has enormous relevance, first of all, to the global south, as was mentioned earlier, but don't underestimate also to the global north. Because in this AI discussion, we cannot divide the world like that anymore. Because a whole number of the countries in my part of the world are lagging behind India in many cases as far as artificial intelligence and its application are concerned on a large scale. So I think this is what I would like to propose to you, that with great confidence, India says, and maybe the closing declaration of this conference will do so, we are presenting with the world with a developmental model of artificial intelligence that is an alternative, a fourth way of addressing digital and AI. And it's one that's built on equity, that's built on scale, that's built on access, that's built on sovereignty and economic development, and brings that together in a totally new way. I think that would be a fantastic, actionable step that would move us forward from this conference. I'll end with just mentioning 5 principles that I think we need to keep in mind for actionable AI. Obviously, public purpose first, the goal, public purpose, common good. Then, of course, institutional capacity building, the transparency I've already mentioned, the equity by design, building in equity and diversity into the design from the start, and that diversity is of course also a strength of India, and the participatory governance. And we need to say clearly, if we are in a democracy, citizens are not just data sources, they are rights holders. And we must keep that in mind as we develop an actionable public health infrastructure. So my conclusion is that actionable AI is about aligning a technological power with a public purpose. And if we manage to do so, and I think India is on its way, the use cases, all the things you have heard recently, it's about building health systems that are efficient, equitable, and legitimate, and health systems that also include preventative action. So I believe that is a key thing. History shows us that technological revolutions in health succeed when they are embedded in strong public institutions, and our task is to ensure that the AI revolution follows the same path. Thank you very much.
Thank you, Dr. Ilona, for grounding this conversation so clearly here. I'm sure all of us would have a lot of takeaways from this talk. I could probably talk about my takeaway, which is that for AI, we do need infrastructure, investments, and most importantly, guardrails. And as we think of AI designing the solutions, keep in mind diversity, trust, and equity. And also be being really mindful about the public purpose, accountability, as well as equity there. So before we begin the panel, I have one more quick question for the audience here as well as online. Our next question here is, name an AI-driven use case or a real-life application to deliver population-level health impact here. So anything that you might be already doing or you wish that where AI should be used, what would be that use case? What could be, where could AI be used for a population-level impact? So we are getting responses there, and I see a lot of you are online. This may take a minute to sort of type what you have in mind. And probably not everything is going to display on this slide, but believe us that we are definitely going to look very closely and see all the recommendations that you have. Some of the ones that I could read were NCD screening, there was the Mother app, there is screening for TB, early detection, wearables. Yeah, so a whole lot of applications, probably some that you're already working on, or they could be those that you wish to work on. So that sort of gives us, an idea. Here we are talking probably of surveillance, we are talking of screening, of looking at different solutions for public health problems related to maternal health, TB, etc. And that sort of reminds us that AI must strengthen the core public health functions that are there, and that is where our efforts should be. I see there are 63 responses from 130 people. I'll just wait for a minute for some of you to respond, and you could continue to respond as we move forward. Thank you everyone for that. We'll now move to our panel, and I'll be inviting our moderator for the panel, Dr. Adam Karpathy. Dr. Adam is a Senior Vice President at Vital Strategies based in the New York office, where he leads the Public Health Programs Division, comprising teams working in dozens of countries worldwide to strengthen public health systems and address leading causes of death, illness, and injury. Dr. Karpathy is a globally recognized expert in public health with more than 20 years of leadership experience in epidemiology, programs, emergency response, and policy. Adam, I request you to come here, and I hand it over to you.
Thanks very much. Good evening, and good morning and afternoon to those online. It's a pleasure to be here, a real honor to be in this lovely space with you all, to be joined by so many folks online. We have a wonderful, distinguished panel that I'll invite up to speak with you tonight. And just to frame it and maybe reiterate some of the things that we've already heard, this summit is extraordinary, and there's a lot of demonstrations and display of amazing tools and technologies that are being developed. But really, listening to all the speakers and seeing all of the sessions, what comes through is the strong focus, not only on those new technologies, on the development of those tools, but on the scaling and the sustainability. It's present in almost every session that's being put on. And that's really what we're talking about here today, is how do we achieve public health impact. And so that's what we're going to be listening to our panelists talk about. And maybe just to break down a little bit more of what could public health impact mean. I think certainly when we think of public health impact, we think of population health. We think of the health of communities. That's the scale dimension, not where individual level interventions come in aggregate and are scaled to affect entire populations. There's a lot of the use cases and examples and tools and systems are focused on healthcare delivery. It's also important, as we know, as public health practitioners, that public health impact comes not only from the healthcare delivery system, but from the environment in which we live, the societies in which we live, the social contexts in which we live. And so as we think about AI impacting public health, population health, we need to think not only of healthcare delivery, which is obviously extremely important, but of those wider influences on health as well, which are also potentially leveraged and influenced by AI. And then last, what we mean by public health impact, as many have already said, which you all said in the word cloud, is that population health the improvement in population health must include the reduction of health inequities and the promotion of health equity. So as we think about the enabling environment and the determinants of public health impact, perhaps we can think about those things: population health, contextual influences on health, and the reduction of health inequities. So with that, I'll bring up our distinguished panel. I'll ask them to come up one by one as I introduce you. We have we're honored to have two representatives of government here with us tonight. The first, Dr. L. Swatchicharan, serves as Deputy Director General at the Directorate General of Health Services under the Union Ministry of Health and Family Welfare, Government of India. He also holds the charge of Director, Emergency Medical Relief. He oversees a wide array of national health programs at the Union Health Ministry. Dr. Piyush Singla, medical doctor and distinguished Indian Administrative Service Officer, renowned for his extensive leadership and senior management experience in the government sector. Dr. Grace Achungura, team leader for health system strengthening in the WHO country office in India, supporting the government's health systems reforms at the union and state level. Dr. Apurva Dharmendra, senior editor at the Lancet Regional Health, Southeast Asia, with expertise in child and adolescent psychiatry and neurodevelopmental disorders. I'll ask you to, we'll have one panelist on his way, racing to get here, and we'll welcome him. Ah, he's here. Fantastic. Fantastic. Mr. Jean-Philbert Sengimana is Chief Digital Advisor for Africa CDC and a Senior Advisor for the Digital Impact Alliance, including serving on boards such as Alliance for Affordable Internet, IntraHealth International, and Place Fund. Fantastic that you've joined us. Okay. So I'm going to come down here. Does this work? Yes, it works. Okay. First question, I'll go to you, Dr. Swatchicharan. India's DPI, digital public infrastructure, is a key enabler of AI in health. Can you describe the system, the incredible system, the ABDM, the Ayushman Bharat Digital Mission, and explain what are the most important elements that come from that system for making AI actionable at scale?
Yeah, thank you, Adam, for the wonderful question. First of all, I would like to start with a disclaimer. I would like to state that, artificial intelligence must sit on a strong system. We cannot let it sit on a weak system. It must rest on digital, public or public health infrastructure. With that quote, I would like to say that the Ayushman Bharat Digital Mission, the ABDM, the central or the federal government's effort is one such direction. So every individual would be provided with what is known as a unique ID called Aadhaar ID, which is portable, which is of longitudinal identity. So you don't need to change it again and again whenever you have, you change the facilities as you go up the referral system. And also it would have an interoperable records. It is based on open standards. There are no silos now once you have an Aadhaar ID, and the continuum of care, the continuity of care as we stride along the referral architecture is ensured by this. And also we are often scared or apprehensive about the privacy. So the consent architecture in Aadhaar ID is privacy by design, and also ensure that the trust is embedded in that. And also we have the verified registries, authenticated professionals and facilities working in the background. So what makes this AI scalable in India is that it is a structured, standardized data. If you don't do that, I was thinking loud when we were discussing the initial discussion, then if we do not make it strong, that we might end up what is known as automating the chaos. So we have some chaos, and then if we put AI there, then we might be automating the chaos. So that structured and standardized data is trying to be ensured by the Ayushman Bharat Digital Mission. And the population scale longitudinal data sets, which is also predictive and also for the preventive models, is also has to be there. Otherwise, if we do only the treatment component, then it is not scalable. We are not focusing on the total natural life course of a particular disease. And also we have the real-time workflow integration in terms of telemedicine and program dashboards to let us, the program managers, monitor what's happening in which particular state, in which program. And the governance and trust issues like ethics, consent, and auditability is also ensured. So institutional integration is also one of the main features of this. And I would like to emphasize once again that Ayushman Bharat Digital Missions turns health data into a public digital good that we had just described, and artificial intelligence is now going to shift from pilots to systems and system-wide intelligence, actionable, equitable, and sustainable. That should be our goal for this country, and we are striving towards this. Thank you.
Thank you so much. And really a great way to kick off to talk about such a foundational system, as you say, structured data. I love that line, try to avoid automating the chaos. I'll turn to you, Dr. Achungura from WHO. From your perspective, from WHO's perspective, what's the role of WHO in supporting countries on building those effective foundational elements to ensure that AI can be adopted and scaled safely and equitably for public health impact?
Okay. Thank you very much, and good evening, everyone. WHO is doing a lot to work with governments, and both at the global level, regional, and the country level. I believe many of you are aware of the global initiative that WHO is implementing together with the World Intellectual Property Organization and ITU, that is, has come up with some guidance on regulation for AI, ethical standards for AI, governance frameworks for AI, regulating AI, intellectual property rights. So all that guidance is helping countries to be able to frame their AI initiatives in a way that ensures transparency, but also accountability and responsible and safe AI. That's one. Two, within the broader framework of digital health, we have the Global Digital Health Initiative that is working with many countries to produce digital health strategies. And nested within that, of course, is the AI and ML work for many of the countries. Not many have been fortunate, like India, to be able to move towards a national AI strategy for health, but at least that already begins to set in place some of the foundational issues around data quality, data completeness, and ensuring integrated data systems, and as well as the digital public infrastructure for health. Now, when we bring that down to a country level, I'm going to use our example as India, working with the country, with the regional office CRO, in terms of what we have been doing to kind of show what is possible. So one, in terms of the foundational issues, supporting work around policy formulation and strategies, like we supported SAHI, which was launched today by the Honorable Minister of Health. Such strategies help in setting in place the key pillars that are needed for systematic deployment of AI for action. Some of the foundations, and identifying the different roles and responsibilities and who should take them on. Secondly, we work as WHO to support the move from pilots into integration into systems. So for instance, WHO has developed a toolkit for readiness assessment of systems for adoption of AI. India has not yet moved to that, but that is one of the things that is planned within the SAHI for ensuring that we move beyond pilots and innovations that are not yet scaled up to the system level. The other thing we're doing a lot of is knowledge sharing. So I'm sure some of you have attended our one of our sessions that we had on the AI compendium, where we were able to canvas through more than 300 startups, pick up some of the innovations on AI in health, and that is one of the ways we are sharing some of the innovations. The other thing we are doing is convening stakeholders to be able to share knowledge across one another. So for instance, within the confines of the Impact Summit, we held the Winter Dialogue, which with many of the partners that I see here, and that enabled us to cross-fertilize across different people. The other thing that we're doing is on research and development. We are partnering with some key developers to help guide them from inception through to working with them to evaluate some of their products in order to ensure that they are adopted by the government so that they can be taken to scale. I'll stop there for now.
Thank you so much, and thank you for reminding us of WHO's kind of dual role in establishing and propagating normative guidance, best practices, and also for directly supporting governments. Thank you very much. You ended by talking about helping with processes around adoption of AI. And so maybe I'll turn to you, Dr. Dharmendra, and talk a little bit about how to bring AI into systems. What standards of evidence, evaluation. There were several sessions at the summit on this, because getting to scale means, well, as we've said, moving beyond pilots, but the process of bringing that into government systems needs to be done carefully. So could you reflect on that?
Thank you for the question, and good evening, everyone. So as we heard earlier today, all public health interventions have been innovations at one point in time. And so when I think about how we need, what level of evidence we need to get AI to be scaled into systems, I look at it like any other public health intervention. And as we also heard earlier, we heard that data is power. So to get that sort of data, we need research that is, first of all, transparent about origins of data, data that avoids biases, data that involves the frontline stakeholders into design and implementation, and data that is, with multiple methods. We can have trials, we could have qualitative studies, but that is centered in the region, in the country, and so it's relevant to the population it's supposed to serve. Beyond that, we also need to look at all the practical aspects. So we need studies on cost effectiveness, on utility. We need to study the implementation processes. Once something has been implemented, we need to have a system where we can, and that too implemented in real world clinical workflows or embedded within institutes to make the most impact. We need to have a system that monitors it and follows up for a long period of time. And in order to build trust, as has been highlighted today, we need to report negative outcomes or unintended outcomes of implementing these tools. So, thanks.
No, thank you very much. And I think that one of those foundational dimensions of readiness for scaling is this issue of screening and assessment of new tools, and all the studies and methods that you described, extremely useful. Jean Philbert, you work at Africa CDC, you interact with many, many countries on these issues. Could you reflect on perhaps some of those use cases that we talked about around disease surveillance, around early warning systems, and on government decision-making in general? What are some best practices? How in your experience, have you seen those use cases optimized across so many different countries with very different data contexts?
First of all, I'll have to say that I'm so happy to be here I was supposed to run late, but I beat the traffic of Delhi. So, in my experience, I think what we've observed over the last couple of years is serious attempts by countries to really leverage the power of technology, and this time AI. But those efforts have been hampered by the fact that there is fragmentation in the space. Fragmentation in data, fragmentation in infrastructure. So we see public digital infrastructure as the answer to that problem of fragmentation. And it's something that is being adopted quite robustly by governments. And it's something that Africa looks up a lot to India to emulate some of the experiences that India has set up. So infrastructure happens to be the first thing, and many speakers before me spoke about it. The second thing is investment. We've been looking at investment, especially in digital health, mostly coming from governments and international development partners. But increasingly, countries are looking towards having the private sector also as a source of investment. Kenya is leading the way. Kenya is rolling out what they call the National Digital Health Superhighway. It's a $700 million initiative that the government could not have mobilized. But what they did is to find a business model around it, find a way citizens can contribute 2% of their medical cost or health cost towards the deployment of that infrastructure, and then government goes ahead and borrows that money. So I think Kenya is on the way to become the first country in Africa that will have PHC fully digitized, and many countries are following, and I'm part of encouraging many more countries to follow that example of a PPP. The third experience is around really what do we mean by intelligence. It has to be contextual, not just in terms of language, which is really important, but also in terms of population, genetic characteristics. So we need to think about where is the data where all these models are going to train on when every country is raising their arms in terms of data sovereignty. So that's a challenge that we need to resolve, because Africa with 55 markets, we should be like India, 1.5 billion, our population, but the fragmentation is worse on the continent. Then finally, the impact. When you talk about impact, in the public health circles, we tend to look at health outcomes as the most important impact. But I found in my experience that if you don't talk about economic impact, saving lives, but also livelihoods, I think the challenge to us as a community is to be able to translate the public health impact into economic impact, either money we save or money we make. Otherwise, it will be really difficult to convince ministries of finance to give us more money to create more impact. Let me pause here.
Thank you so much, and thank you for reminding us that public health has that expansive definition of well-being, as WHO says. And thanks also for mentioning some of those models of scaling and sustainability, public-private partnerships, et cetera. So thank you very much. So we'll come back to our government representatives for the end of this first round. Dr. Singla, could you reflect, given India's federal structure, the diversity across the country, how could AI solutions be effectively contextualized and adapted at the state and union territory level, accommodating multiple languages, diverse local user needs, to ensure that it is not implemented inequitably, and that all of that diversity is reflected in the systems? Thank you.
Thank you, WHO CRO and Vital Strategies, for having me. I'll come to the point which Dr. Ilona mentioned during her keynote address. That was trust. As a public policy practitioner for the last 14 years in state of Jammu and Kashmir, what I have observed that a lot of solutions which are given to the public are actually not adopted by the public. So, in my opinion, even in the word cloud, I put the word trust, but gradually I've seen that word phased out outside somewhere. So that is actually the reality for any public policy intervention. Trust with the community is something which we really should strive for. That should be first and foremost our focus, to engage the community. So when we talk of AI especially, AI should speak the local language. I'm saying local language not from the viewpoint of translation. Generally we see language from the perspective of translation. But when we talk of language, it means compassion, it means adaptability, it means local upscalability involving the local community. Now AI has just limited itself to the translation part, which it's not going to work. Seeing state like UT, like Jammu and Kashmir, for the last 14 years, we have so much diversity. We have seen Jammu is very different, speaks very different language. Kashmir is so different, speaks very different language. And there are many other dialects. As we move 10 kilometers away from Jammu, the dialect change. So we cannot move away from those realities and say, look, we have one solution. It will go to the local level. So top-down standardizations do help, but local bottoms-up planning in adoption is the key, in my opinion. One thing we are trying in Jammu and Kashmir is we are getting in touch with the higher educational institutions like IIT, Indian Institute of Technology, Jammu, and some premier health institutions like SKIMS in Srinagar, and try to, in collaboration, and we are in discussion with ICMR to set up some computational health unit locally, so that we know the local disease burden, we know the local challenges. And very beautifully, Ayushman Bharat Digital Mission has given a broad guidelines of interoperability, standardization, what are the standards should look like, and that's how it should be. That the states and UTs be the conveners, not just the implementers. So we can come up with our local solutions, and then we can take it forward in the implementation. Thank you so much.
Thank you. Thanks for those inspiring remarks, really, and reminding us that public health practice is local, and we need to keep that in our processes, in all of our systems. We'll end our panel with just a brief round, asking you reflect just for a minute on the following question that we've been talking about. I would remind everyone to check out the Foundations and Futures report. You can link to it on your table. That's the report that Dr. Etiebet mentioned earlier, where we at Vital Strategies reached out to government officials and leaders around the world on issues of AI implementation, and elicited from them their thoughts about what those foundations need to be in order to realize the future of AI. And I think, not surprisingly, a few themes were mentioned. The importance of using these or embedding these new AI tools, new technologies, layered upon digitized systems. We've heard about that. Digital public infrastructure as the base for AI scaling. The need for those tools to be assessed and implemented by a capacitated workforce, to have strong governance systems, and obviously sustainable financing. So those are just some of those ingredients. So what I'd like to ask the panelists, if you were to identify kind of an area of particular need or of particular importance around that enabling ecosystem, I think is the term that WHO and the government of India use around this. What would you highlight as a critical foundational condition or element of that enabling ecosystem that would maximize the value and the scale of AI for public health?
Thank you. I think the real question is it's not whether we can deploy artificial intelligence, but the real question is, can our programs absorb AI? So with that foundation, I would like to submit 5 practical steps. One is start with the program priority. You should identify the priority first. Second is embed AI into the workflows. If you do that, you'll gain a lot in there. And then the other problem that we face is the population stratification. So we keep screening the people who has the high level of health-seeking behavior and leave out those who do not come at all. So you need to use that AI for doing that, to stratify the population and also identify high-risk burden districts, etc. And also the fourth one is build the workforce confidence. So you, with AI, with teleconsultation, you can do that. Otherwise, it takes a long years to build the super specialists and make them available in the public health delivery system. And last but not least is the governance and the outcome monitoring. So that is what we need to do. That the scale will happen through institutionalization, and if artificial intelligence is program aligned, workflow integrated, workforce supported, ethically governed, and outcome measure, it moves from innovation to impact.
I think that was very comprehensive. But two things stood out to me. Number one was the point of finding the purpose of this technology and building from the grassroots up. And I think it's very important that we encourage the research landscape with those two priorities in mind. So from the part of a publisher, to support early career researchers, to encourage policy pieces on these sorts of issues. I think that's really important, because I think if we don't define what the needs of the population is and where this can be best implemented, we're not going to get much further.
So in my opinion, the 5 priority areas for AI adoption: human in the loop capacity building. So whenever we talk of CDSS, clinical decision support structures, generally it is just the technology, but without human support, this is not going to work. Second, scalability through digital public interface. For last many years, India has invested heavily in the DPI, and it has grown to a different level. So I think it's a time to get the benefits out of it in the health sector as well. Then the responsible and ethical AI governance. So accountability is one key area which has to be fixed in. It's a big gray area which still need to more deliberations. And use case first, not tech first deployment. I see a lot of FOMO on the AI adoption as well, where you do not need AI, you try to put AI, just we want to do something. So let there be a good use case, really in the interest of public health, then take it forward. Then the data foundation and interoperability standards. I think this is another key area which I feel from the government side is important. Thank you.
AI FOMO, I love it.
Yeah, thank you so much. I'll just speak to 3 things. I think they've spoken a lot on some of the things. On the issue of governance, I think we need to build regulatory capacity, both have in place frameworks for for validation of the tools, pre-deployment, and then post-market surveillance, as she was talking about. Also the prioritization frameworks for determining the worth of investment in a particular tool to take it to scale. The other thing around the governance frameworks is also ensuring ethical application of AI. And so in terms with that also, one of the things we're suggesting is ethical review boards, and equipping whoever is on those review boards to be able to address the issue of AI. Grievance redressal mechanisms are important, and also fortifying procurement systems so that they are able to assess AI tools for health in order to be able to streamline procurement. Change management is very critical. It goes hand in hand with skilling health workforce, and that is pre-service and in-service. And in-service, it's not just the policymakers, it goes right down up to the frontline health workers, the usher, ensuring that they have the competencies to deal with the tool. Lastly, public financing for, he's talked about private financing, and that is very critical, but public financing is predictable, it is sustainable, and this public financing should be across the entire gamut, right from stimulating innovation to research. It should also finance research, should finance the regulatory capacities, the entire gamut. Thank you.
One word from me: collaboration. No one can do it alone. So for us to realize the impact for AI in public health, we need to work together. And the fact that I'm here, I also wanted to extend an invitation to all of you to join us, for those who believe in collaboration, but also action, to join us in Kigali for the Health Tech Summit, the Africa Health Tech Summit in September. 30th to 2nd of October. So for those who do some work in Africa, who would like to bring some innovation, I believe that there is unrealized potential in terms of collaboration between Africa and India, and we can walk the talk during that event and talk more. Thank you so much.
Thank you very much. Thank you very much to all our distinguished panelists. Such a stimulating discussion, very much appreciated. I think we have a Menti question that we wanted to put up, which basically recapitulates what I asked our panelists and wanted to get your input as well around those key foundational ingredients. So if you would like to contribute, build on what you've already heard, or offer some additional ones, that would be well appreciated. And as Nidhi said, we will take them all into account. I think I'll turn it back to you, Nidhi. Yes.
Thank you. So I see some of you have already started responding. So our question to you, you've heard all the panelists. Now the question to you is, what is the most important enabling conditions required for AI in health to be effectively implemented at scale for population health impact? I'd request those in the room and also those online to put in their responses. Infrastructure coming up big. We have collaboration, regulation. We have governance there. Data policy. Digital and AI literacy, transparency. What do you think is most foundational for doing this as we think of AI solutions? Capacity building, trust and carefulness. Okay. So as you see, a lot of these themes are something that have come up repeatedly in Ilona's remarks as well as in the panel, as we heard all of them. Thank you for putting in your thoughts. And I'd request you to please continue, because I still see 142 online with 52 responses. So please do respond. Thank you. Over to you.
Okay, so while we still respond, thank you very much. I think hearing all of you, makes us think more on how can we build the new AI-led health systems for the future. So before we end, firstly, I want to thank you all for taking time out, being with us and participating. I think it'll be unfair for me to thank two sort of groups here. One is really the people who put this show. The silent soldiers working behind, though some of us are the face. As a country director for Vital, take a lot of credit, but I don't do much. But there are people like Nidhi, you heard, Adam, come here. My team here who's been working behind, I can name few of them, Jagriti, Ruchika, Prachi again, someone here. From WHO CRO, we had Padmini again who helped us. Thank you, Resham. So thank you all. And I think before we end, I'd like to invite Dr. Karthik Arappa, without whose support we wouldn't have been able to sort of visualize what to focus on and how to do. So Dr. Karthik Arappa, please. He doesn't need an introduction, so I won't go into the details.
Thank you, Mr. Singh. Good evening, friends. Thank you so much for taking the time to join us. It must have been a very long day for you, but for you to come over here is an absolute pleasure. It's also been a very important day for us because the World Health Organization with Government of India, we've been able to launch the National AI Strategy for Health, which has certainly taken us about 6 to 8 months' time. So why this collaboration with Vital Strategies is important, because I think just getting the strategy is just a piece of paper. What is going to be important is just getting it implemented. So Mr. Singh, you're essentially going to we're going to trouble you more often. We need more partners like Vital Strategies and others, because I think when we want to get the ball rolling, on the ground is going to be the most challenging thing. So for friends and colleagues, thank you so much for taking the time today. But we also want to encourage you to participate in the implementation roadmap that we're having at the India International Center on 2:30 on 20th of February on Friday. So if you have time, please mark it on your calendars. That's an opportunity where the government and WHO would actually be rolling it out to partners to think, how do we really put this strategy onto implementation, think about what should the implementation pathways look like. So thank you all so much again. Thank you for the panel for those great insights. Thank you so much for the Vital Strategies team. Mary, who met her at Kenya. It's been wonderful to actually get this collaboration going. And thank you all so much, and I hope you have a great evening ahead. Thank you.